Taruna Sharma is also there. I'll give mic to them if you can reflect upon how you felt. Are you attending? Have you attended these sessions for the last 2 days, or how was your experience on the conference? Very nice. I've given mic to Bachu Suknaji. Namaste. Am I audible to you? Or Dr. Taruna Sharma ji? Am I able to reach you? Namaste. Would you like to share any reflections on the discussions, what we had for the last 2 days? How are you able to connect to this content? Yeah. Upasana ji is also there. Be nice if you can get some reflections. Okay. In fact, it was a very fruitful discussions what we had on the last 2 days. On the first day, we had the reflections on the need for the holistic health, and that on that day we could actually come out with very valuable points, and most of the points, all our panelists were able to see that there is definitely a need for the holistic health. And yesterday, when we spoke about the vision, when we put the presentation on the vision on the holistic health, we were able to come out with very valuable points on the vision part also. So based on the content what we had discussed, the need of holistic health and the vision part, today we will go for the implementation of this holistic health. So I think we can formally start the session on today's discussion. So right. So namaste to all. My name is Deepesh. I'm in the role of the regional coordinator of Southwestern region of NCCI-PAICT. And let me warmly welcome all our esteemed panelists and all the delegates who have joined from various locations around the world for the day 3 of panel discussion on holistic human health. And I also welcome all the participants who have joined in the live streaming via the YouTube channel also, and also our support team, our volunteers to the session. So YouTube participants, they can put their questions or comments if you have any, and we will try to take some of them as soon as possible. So in today's session, as we had in the last 2 days also, the moderator for this session is Dr. Mrinalini Gunasheelan. I think we don't have to again introduce her, but still, if at all somebody new is there in the part of attendees, Dr. Mrinalini is currently working as Associate Professor of Anesthesiology in SRM Medical College Hospital and Research Center of SRM IST Chennai, India. She has got more than 10 years of teaching and clinical experience, and she's also a certified pain management physician from National Health Education, England. So let me warmly welcome Dr. Mrinalini Gunasheelan for taking over the role of the moderator. Over to you, Dr. Mrinalini. Namaste.
Namaste, Bhaiya. And thank you so much for this warm introduction. And I am truly honored to be here once again as the moderator for the day 3 panel discussion, which is going to be on implementation of value-based holistic human health. And once again, I am deeply honored, and it's a real pleasure to welcome all the panelists who have joined us here for the 3rd day. So for all the new delegates and all the new panelists who have joined us today, I'll quickly introduce the panelists who are present here with us. So we have Dr. Vidya with us. Dr. Vidya has done her MD DNB in anatomy in JIPMER, and she's currently working as an assistant professor in JIPMER. She is also the secretary of Sri Paspo Group of Educational Institutions in Tamil Nadu, and she's a member of National Academy of Medical Sciences, India. Welcome, Dr. Vidya. And we have Dr. Swapan Chanana with us. Sir is from PCTA Group of Institutions in Ludhiana, and Sir has been teaching in the Department of Business Management for the last 25 years. And additionally, he is also handling the responsibility of Director Students Welfare. And he has been teaching the subject of universal human values regularly to various courses in his institution. Welcome, sir.
Namaste to all. Thank you.
Thank you, sir. And we have Dr. Akhilesh Shukla with us. Sir has done his MD and PhD in Ayurveda Samhita. Sir has also done MSc Yoga and MA in Sanskrit. He is a committee member in All India Council of Technical Education Student Induction Program syllabus, and he is currently working as an assistant professor in All India Institutes of Ayurveda, Goa. Very happy to have you with us, sir. Welcome, sir. Yeah, thank you. We have Dr. Monika Sharma. She has done MSc PhD in Mathematics and MSc in Value Education and Spirituality. And ma'am is currently working as Assistant Professor in Delhi Technical University. Welcome, ma'am. And ma'am has also recently published her book.
Namaste to all. I'm glad to be here, a part of the panelist. You gave me opportunity. It's very warming for me.
Recently published her book. Can you just say one line or two line about that, madam?
Okay, it's very. I'm getting this opportunity to share this book here in this platform. It's about actually. I have written this book on ancient knowledge system, and it's a very small book. It has only two chapters. One is on evolution of maths, like from Vedic times to up to till now, and how maths is evolving from that age to up to now. And second is from the Bhagavad Gita. It's about the world drama cycle. So this is it has two chapters, and it is published from London. So I got this opportunity to publish this book, and it's very I feel very warm to share on this platform. Thank you.
Thank you, ma'am. Congrats, ma'am. And finally, we have Dr. Satyanarayanan with us. Sir has done MD in pharmacology, and he's currently working as Associate Dean in Students Affairs and Professor of Pharmacology in SRM Medical College Hospital Research Center in Tamil Nadu. He is serving as a chairperson of UHV committee, and he's a core member of Medical Education Department of the institution. Welcome, sir.
Namaste.
Namaste, sir.
Yeah.
So once again, before we dive into the discussion, I'd like to share the format of this panel discussion for the benefit of those who have joined new today. So the entire session is structured for 90 minutes, and it will begin with a brief 10-minute recap from the previous day panel discussion summary and from the keynote topics which are covered and about the topic which we are going to see today and the UHV point of view. So the discussion session is scheduled into 2 or 3 rounds, with each panelist will be allocated approximately 3 to 4 minutes per response to the question asked by the moderator. And if the time exceeds, there will be a bell. And after 45 minutes of the discussion is over, we'll have a 10 minutes question answer session with our delegates. And finally, I'll formally close this forum for the day by presenting a brief summary of the essence of today's discussion. And I request all the panelists to keep your videos on for the entire session. So with this, let me give a quick briefing of the UHV point of view on today's topic. So I'll just start sharing my screen.
Can put
So
it in
is the screen
slideshow.
in full mode
Yeah, right.
and visible?
Yeah, it's
Yes. So today our topic will be implementation of value-based holistic human health. So in the past 2 days, we saw about the achievements of healthcare system, present healthcare system, but along with it, we also saw many concerns in healthcare system, and we came to a general consensus that there is a need for a different perspective, a holistic perspective for human health and the healthcare system. And on day 2, we discussed about the vision of holistic human health, where we saw various approaches, the current approach and the UHV point of view approaches, which can be used to view human being and the health and the entire healthcare system. And today we'll be seeing about how these approaches can be implemented in holistic health in our individual lives and in the medical education stream. So just to give a quick recap about the approaches, the current approach is like body-centric approach, where human being is viewed as the body and there is no role for self in health of the body. So when it comes to health of the body, it is mostly dependent upon various tests for early detection of the diseases, and the dependency is more on medicine and machines and treatments. And sometimes these medications are taken even for lifelong. So the question still remains, are we really curing the disease? Are we understanding and addressing the root cause of the diseases? So one another approach that is proposed here that can be considered upon is the holistic approach for human health. So in this approach, human being is seen as the coexistence of self and the body, and here health of the self is given the number one priority. So when the health of the self is healthy, it takes a natural responsibility for health of the body. So and when it comes to health of the body, programs were suggested for staying healthy rather than managing the diseases. So in the program, we have given priority to first intake. Intake includes not only food, but also water, air, sunlight, and the different sensations we take in through our body that can affect the mental health. And then incorporating routine healthy lifestyle habits. And number 2 would be to incorporate labor and exercises. And 3 would be for postures for regulated internal and external body organs and regulated breathing. And only as a last resort, we go in for medicines and dependency on machines and treatment. So with this, with the health of the self given the priority, it takes natural responsibility for health of the body, and also it takes responsibility for health of the environment, which includes the family, society, and nature. So when the health of the self is attained through right understanding and right feeling, the health of the body and the health of the family, society, and nature turn out to be the natural outcome of this. So, when we need to understand the proposed holistic perspective on human health, we need to understand three aspects. Number one will be the mental health or health of the self. Number two would be the physical health or health of the body. And the third would be conditions for mental and physical health, that is, health of the environment. So, when the health of the self is given the first priority, we need to understand the human being, and we need to start by understanding the self, and this will lead to harmony in the self and lead to a healthy self. So in order to understand the physical health, we need understanding about the body, which will lead to harmony in the body and the healthy body. And when it comes to conditions for mental and physical health, we need to understand the environment for these conditions, that is, this will family, society, and nature or existence. So this will lead to harmony in the family, harmony in the society, and harmony in the nature or existence, with natural outcome of a healthy environment. So understanding all of these and seeing the relationship and harmony at all the levels and our role in the existence will result in health in the self, health in the body, and health in the environment, and ultimately well-being of all. So now we'll see about the implementation of holistic vision of health, that is the way forward. So to understand the holistic vision of health, we need to understand first the universal principles of health. So these principles are based on the fundamental reality of who we are as human beings, the environment we live in, and our role or participation in the environment. So based on this understanding of the universal principles of health, next step would be to follow the recommendations of the health, which are based on the universal principles. And finally, then we go to the implementation of these recommendations to various practices that are in alignment with the recommendations. So to help an understanding, we can go through workshops and courses may be made use of in the following. So we can make use of medical education and medical trainings and in our daily practices in institutions and in individual thing. So when it comes to medical education, we can go for sensitizing workshops on universal human values and holistic human health in academia in medical education, which is both for faculty and for students. And particularly for medical students, we can incorporate universal human value and holistic human health courses in their curriculum. In other medical trainings, more research on the self, that is the consciousness part, is recommended, and universal human value and holistic health courses and workshops as a part of continuing medical education is recommended. So, in practice, to maintenance of the health, we can try incorporating the universal human values and holistic health outcomes, that is the holistic parameters of health, as requirements in medical code or manual of the particular institution, and holistic centers of well-being, which has integrated approach of various streams with UHV and holistic human health workshops for all staffs, doctors and patients can be utilized. So when it comes to implementation in health education, the first step would be preparation of faculty and regarding the details of the courses. So we have faculty development programs on universal human values, and we have faculty development programs on holistic human health. So when it comes to FTPs on UHV, we have introductory UHV FTP, which is 3-day face-to-face FTP, or it can be a 5-day online FTP. And UHV2 FTP on universal human value is a 5-day face-to-face, or it can be a 6-day online FTPs. And FTPs on holistic human health with the objective of value-based holistic vision for health and responsibility and competency to stay healthy. We have introductory faculty development program for 5 days. It can be either online or face-to-face. And we have full faculty development program for 10 days face-to-face. So some of the things which will be covered here are holistic self-body-centric approach, universal health principles which are based on the reality of existence, and recommendations regarding the holistic health, then self-observation and self-exploration exercises where understanding the self and body by direct observations are dealt with. And we have health tracker, that is tracking one's progress in health, is also incorporated in these FTPs on holistic human health. So all these FTPs can be conducted in association with AICTE, and it can be self-funded, or few of the FTPs are also funded by AICTE. And the next step would be to implementation of these courses for students in education. So currently we have in engineering side, we have this 1 semester 3 credit course on UHV. When it comes to holistic human health courses, we can consider it as an add-on courses in the current curriculum. So we have these 3 courses as a part of student courses. So UHV1, which is Introduction to Universal Human Value, has been incorporated as a part of student induction program. UHV2, that is Foundation Course in Human Values and Professional Ethics, Understanding Harmony and Ethical Human Conduct. This is taken as a 3 credit course for 1 semester. And we have UHV 7A, that is a foundation course on holistic human health, its philosophy and practices, which can also be incorporated in courses for the students. So eventually, holistic value-based education and inclusion of self in research and evidence-based medicines can be incorporated once these courses are taken up in the academia. So the third step would be maintenance of the health. So when it comes to implementation and health maintenance, the suggested way forward is counseling and wellness centers. So holistic centers of well-being, they provide an integrated approach to well-being of all in addition to the current system of medicine. So health education and practice on how to stay healthy for all the patients, doctors and staffs are dealt with in these centers of well-being. We have, in addition to that, counseling services and integrated healthcare system and responsibility of all towards keeping the self, body and environment in good health to ensure well-being in context of all these will be the core content and objective of such holistic centers of well-being. So finally, to aid to go forward with these courses and faculty development programs, we have various resources and resource materials which are available. So to begin with, the resources and support for implementation of the workshops in your institutions, we have resource persons training the trainers, and all the resource materials are available free to all. And we have this holistic human health book, a foundation course on holistic human value, its philosophy and practice. This is available as an ebook, totally free and freely downloadable by all in the link uhv.org.in foundation/course. In addition to this, we also have various books, videos, and other resource materials which are freely available on the website and freely downloadable by all, which are dealing with the various FDPs which have been conducted, and the content of UHVs and holistic health are available in this. And we also have audios and videos of self-exploratory exercises, that is observing self and the body, and sharing of participants after going through these exercises, particularly on the impact on their mental and physical health, how it has come to a positive change. All these are also freely available in these websites, and also it is available for free viewing in YouTube in the UHV YouTube channel. And other supports are available through regional coordinators for UHV Pan India and UHV nodal centers in various institutions Pan India. And we also have outline of the holistic health courses that can be a useful resource material. So with this, I'll stop the sharing and the UHV point for implementation, and we'll move on to the discussion. So I once again thank you all for listening to that brief point of view on implementation. So today our discussion will be centered around like 4 topics: the interest in knowing more about this holistic vision, the possibility of implementation, the challenges that can be faced or anticipated challenges, the ways to overcome it, and finally, the commitments from new panelists. So now let me first begin with this question: the interest in knowing more on holistic vision for health. So for this, I would call Dr. Vidya. So would you be more interested in getting to know more about some of the proposals that were discussed in the holistic vision for health?
Absolutely, yes. Right. I also very much towards this holistic health approach. Either in all the ways, either online or in face to face, I would like to attend some faculty development programs. And I have downloaded this e-book what you are telling so far, and I have started reading it also. It was quite interesting, and that's why initially I told here afterwards I won't go behind the treatment. My generation, my kids has to prevention is should be the first choice for them, then only they have to go for other things and all. So I would like to engage this. And one more thing, like not only for medical students, I am personally dealing with paramedical students. This nursing course and pharmacy courses and all we are running in our institutions. So what I felt is for nursing students it is very much desirable. Already they are working on the humanitarian basis only. In spite of that, if they are aware of these kind of things, human values, universal health and holistic health approach and all, definitely it is helpful for their professions. So there will be no more professionalist, and already they are taking care of the patients nicely. In addition to that, all these things will give them an encouragement. They'll also learn more things. So I'm looking forward how to implement these kind of valuable courses in my institution personally. So obviously, yes. And I would like to thank you for giving me this opportunity to come across all these things and to interact with most of the professors, well-learned persons here. So initially I told like in medical education, we do have foundation courses and we have implemented most of the things what you are discussing about. But still I felt like there are more things to be discussed and more things to be implemented in future. So I'm very well into it. Thank you.
Yeah, thank you, Dr. Vidya. It's nice and very inspiring to see this change in you after attending only 2 days, and this is your third day in our conference. That's very nice and inspiring. Thank you so much. And you have expressed your doubts on how to go forward with this.
Yes.
And our entire panel discussion today for the next 1 hour is going to revolve around that. I'm sure you'll be getting many ideas on how to go about it. And we're all here. Many resource persons are there to guide us. Yes.
Sure.
So I would l- like to ask Dr. Swapan. So you have been exploring UHV for the past few years, but I think you would be new to holistic health. So would you be interested in getting to know more about these proposals, the universal health principles, and the recommendations?
Thank you, Dr. Mrinalini ji, and very nice discussion we are doing for the last 2 days and now implementation part. For your information, UHV is means very holistic course. Means there is a topic of health also, because when we are talking about the body, last 2 days we are saying that human being, understanding human being, then human being is the coexistence of self and body. So body is a very, very important tool, instrument. So in human values also, we are talking about this, how to take care of the health of the body, and all this program, that intake, daily routine, and physical work. And actually I worked on that also, because body is very important. And I shared with you that I had some body issues. So then I worked on this proposal of this healthy body by doing all this, and then my body became leaner, and now I'm very much more active and energetic. But then, yes, I think there's more scope, and then this holistic health program. I think there is a scope that I want to go. I want to know more about it. And even in our college also, I think UHV is already there, but then I think there is a scope that we all go through this holistic human health courses also. So I am for this, because I have already seen the advantage of to me. Then, as Dr. Vidya said, that we want it for our children also. So I think if it can be introduced at the education level, I think it will be coming from the teachers. Then I think our children will also be benefited, because sometimes we parents are trying our best and we are trying to give them the proposal, but sometimes out of concern we try to just instruct them. But it will come from the teachers and the education. Then I think it will bring the desired results, and our younger generation will be also benefited, and their health will be taken care of, and then overall we will have healthy society. So yes, I'm for it. There's a huge scope that we can work on this. And after this conference, I think this has given us a confidence for last 3 days. Means we all are for this. Thank you. This is my take on this. Thank you.
Thank you, Swapan sir. So we'll go on to the possibility of implementation. So again, I would like to ask Dr. Swapan. So what do you see as the possibility of implementing this holistic vision of health in your institution? You already said that it has to start with the faculty implementing the program for health in his or her personal life, so the change can be seen by the student and students get inspired to follow it. But here I would specifically ask about implementation, possibility of implementation of workshops and FTPs on holistic human health.
Yes, I think as I also have we have BTech course in which already the UHV is there. But then there's a course of pharmacy also in our college, in which this UHV course is not there. And I see that they're also mostly talking about the disease and the medicines. But then, as we know that for last 3 days we are talking that if naturally the health will come to us, then all this, it will result into means many nice results overall for the society, as well as the financial burden we all are talking about, like even Dr. Vidya says again and again, prevention. So I think yes, it will not be easy, because when we are when we are trying to change something, change is always not sometimes welcome. But then overall, I think we all can see last 3 days we are discussing that from all the streams, even the doctors and all, we are coming to this that this is needed. Once we are determined that it is needed and the vision is also there, like you are telling in your presentation already, the resource persons are there and there's a book already. So this is very important that are we ready with the material and with all this so that we can enter into it with some confidence that, okay, we have material, we have resource persons. And then slowly and slowly we can hold workshops. As you said, when we start from the people program. And then when people will be realizing it, we may call the parents also, but especially the directors. I think it start from the top. And I think I can influence in my organization because in UHV also, this is how it all started. And we attended the workshops, and then even one person is finding it useful, and if he is at the top, then I think it can flow to the bottom. And at my institute, I'm ready to take that initiative, and then I can talk to my directors. And first of all, I will let them to attend the workshop, and then slowly and slowly, this value added courses can be there. Like best part is this, even new education policy right now is talking about this all holistic health and the value added courses. So I think stage is set for that, and this conference I think will give that push. And I'm more motivated after attending this 3 days conference. So definitely, I think in my institute, I'm going to talk about this. Even I told my directors and all that I'm going for a conference, and then I will share my whatever my takeaways. So I will definitely talk to them, and then we can hold workshops, and then slowly and slowly we can go for the courses also, because this is the need of the hour for our next generation and for us also to come back to the health. Thank you.
Thank you, Dr. Swapan.
I hope I have answered.
Thank you. Yeah, thank you. Thank you, Dr. Swapan. Now I would like to ask Dr. Akhilesh Shukla regarding your views on this holistic vision and the importance of getting to know more on this and the possibility of implementation of such courses in institutions.
Yeah. So, my voice is clear?
Yes, yes.
Okay. So, as my previous speaker they told, and I'm involved with the UHG and human health last 5 years. So, what I feel is the universal human value, the UHV course, this creates a very favorable platform for the implementation of the holistic human health. Because once we are talking about the holistic human health, we should have a proper distinction that I am not merely a body, or the human being is the union of body and the self. Then only we can talk about the health of the body and health of the self. The second important thing is we cannot say the health of the human being in isolation, that we have to understand the human being as the part of the whole existence, and whatever the phenomena which are governing this universe, they are also governing the human body, and all these phenomena, they are also responsible for my healthy state. The third important thing is, if I am thinking about combating the disease, once the disease is manifested, then I feel that it is impossible to take care such a large population. That means we cannot build that level of medical infrastructure. We cannot create that many doctors who can treat the disease once it is manifested. That kind of facility, it is not possible. We have seen the situation of medical field in the recent COVID pandemic. The only thing is, we can work out that the disease should not manifest. At the beginning itself, we can have such a program which can make the human being, or which can keep our health in the healthy state. So if we have these three things, and if we feel that these three things are very important, then naturally it comes that whether there is a program or not. So if we have some program, I think we have one program, and I'm not saying that this is the only thing, and this is the in the perfect stage. What I feel is once we will go to the colleges, once we will start learning, we will feel that there may be a lot of changes which we have to do, and we will able to understand what are the more challenges we have, and accordingly we can goes on modifying, goes on improving. But about the need of the program, I definitely feel, because I am in the medical education, and since last 10 years, I am in the academic and clinical side, also in the research side. So definitely there is a need. And this need only has inspired us to work for this program along with the Sharmila Didi and all this UHB group. So what I feel is the UHV and universal, the holistic human health, these two things go hand by hand. Both should go in the institute in the same way, because this is creating a very favorable platform for us to talk about the holistic human health. So that is what I feel.
Thank you, Dr. Akhilesh. You rightly pointed the importance of the two courses, UHV, where we are getting to explore, understand more about human being as coexistence of body and self, and explore more on self. And then going along with holistic human health, where self is central for the health of the body. Yes, it's very well taken and rightly pointed. Thank you, Dr. Akhilesh. Now,
Yeah.
I would like to ask Dr. Vidya. Dr. Vidya, you expressed a profound interest in getting to know more about these courses and your personal interest in attending these workshops. I would like to ask about your view on introducing these courses for students in your institution. Do you think there's a possibility of that?
So, as I told initially, this is not a one side. There are two sides for it. So we are implementing this kind of courses to the students. We are giving some training for this human values, and we are teaching everything. And this holistic health approach is not, as far as my perception, it is not very well taken by the public yet. So public, what they need is, as I told you, it's a symptomatic treatment only. Still, they are in that mind only. First, my thing is we should create awareness among the entire society. So the direct answer to your question is, of course, there is a possibility from my side to implement all such courses to my students at the management level. I can try and I can get the resources from you people. You are legends here. You are well-trained persons here. So based on your guidance, we can implement everything. But the thing is, it is not, the public also should get my perception, what I understood so far in this 2 3 days. So only we people, that health concerned people, are talking about all these things. Because as I told them, even my kids, I told I wanted for them to go for prevention, not for treatment and all. But if I say something, they are not obeying me. As sir rightly pointed out, everything has to come from the teachers at this moment. So these kind of educations should be started at the primary education level itself. For example, from my own experience, in the recent past, I have seen one video which has been viral, where the China schools educations, they have taken one video and they have posted. So in that, they have mono acted everything about the human values. Say for example, one kid is acting like a elderly person, and one kid, a young person sitting in the bus. If that elderly person is getting inside, this young kid is raising and giving place. Some pregnant lady, some is mono acting like a pregnant lady, and that kid is coming inside, and the well kid is getting and giving place to them. They are giving this human values right from the primary education. Even before that, pre-primary education itself, they are giving this human values and holistic approach. They are doing some mono acting regarding which is good and which is bad behavior. Sitting ideally, they are showing it as a bad behavior, and they are doing some exercises, they are showing it as a good behavior. So likewise, if we want to initiate something, if we want to implement something, as you people told, you have to start from the root. So these kind of implementation, though it is possible for us to introduce now to the health faculties, that is faculty, students everywhere, as you said. But my opinion is like we can start still early. So at least to teach about the human values, ethics, everything in the younger age itself. That is my thing. And of course, there is a possibility from my side that I can implement such courses and such really helpful courses to my students, particularly to my paramedical students right now, which is under my possibility. That's it.
Thank you, Dr. Vidya. You expressed some concern about public hesitating to take it well. I would like to ask Dr. Akhilesh's experience on this. Like sir has been practicing it, implementing it for the past 10 years. We would all like to know your experience, sir, on the views of public.
Yeah, I think that public is taking it very well, including if we go to the very small children and if we ask some very fundamental question about the human life, they are able to say the right answer. Like the UHV starts with a very simple questions. Do you want to be happy in the life? Do you want to be happy and prosper in the life? And do you want the continuity of this? So even children, even the school person, even the layman, he will say this, yes, I want to be healthy. Similarly, if you ask whether you want to be healthy or you want to be diseased, no one will say that I want to be a diseased person. Everyone, they want that I want to be healthy. So now, once you want to be healthy, do you know about the health? Do you understand that you are the union of the human, the body and the self? Are you able to take care of yourself? Are you able to take care of your body? So what is the right program for that? Are you taking the right food? Are you taking care of your health of the self? So if we start with these kind of fundamental question, I think everyone, including the school children also, they understand these fundamentals of the life. So the people, and I feel that health is a very important thing, and everyone, they are very much keen about being healthy, because once you are ill, you cannot have anything in your life. So whatever the physical facility, whatever the things you have accumulated, you cannot enjoy anything once you are not healthy. So I feel that this is the need, and everyone will be very much ready to accept what we are presenting to them. If we have a right program, everyone is ready to accept it. There is nothing like the people are not ready and the people will not accept, or there is some kind of hesitation or a stigma. People are ready, I feel.
Thank you, Dr. Akhilesh. It all starts with sensitization and making people aware that such programs and solution-centric approaches are available. Yes, thank you, Dr. Akhilesh. Now, I would like to ask Dr. Monica Sharma regarding the possibility that you see in implementation of this UHV workshops, FTPs, holistic health workshops, and FTPs in your institutions, and the possibility of introducing these courses for students, UHV
Yeah.
courses.
So as right now I am teaching UHV in BCA first year. So it's a very good initiative of AICT. First, I will want to give thanks to AICT. This is very essential for our children, and as we are moving towards falling down in moral values. So we can catch our student, because since long we are in body consciousness, and at the early stage, the earlier the better. Like we will catch our children first. Now the university has given me a chance to be a coordinator, UHV coordinator. So if I will be there as a coordinator, I will definitely hold workshops for students and faculty members, and definitely bring this course ahead. As what I feel that as I have done MSc spirituality, and spirituality shows me, give me content of self is a metaphysical entity, and it cannot be seen and touched. But UHV has given me a clarity of concept about the association of the role of body and the role of self. So, like for example, I want to give suppose during interaction with someone, and if someone abuse me or say wrong word to me, then the sensation of that sound through ears, body recognizes that sound, and through the and self self read it read that sensation, and give it meaning to that sensation according to the its sanskar of right understanding, or it may be give meaning to the sanskar of assumption based. So that's how, if and that's tell about the state of being of a self. So if we are in the right understandable sanskar we have, then our state of being is happy. And then sensory, then how it associate that it it send messages to the brain to uh, uh, sensory motor nerves, so that it impacts on our internal organs and external organs to secrete like internal organ to secrete adrenaline from kidney, or dopamine from pituitary gland. I think I'm not a medical professional, but from UHV or spirituality I have learned this. And so it impacts our health basically. And chronic diseases like cancer or even diabetic is we can associate this when the organs secrete these bad hormones adrenaline. So it is due to the suppression of negative emotions like anger, say for cancer I can say. Then we can whatever we are state of being, we the basis of which is suppose it's a right understanding and right feeling, then that only we are expressing outside as a responsive behavior expression. And if it is not in the right state of mind, so we will bring through this body as a expression of reactive behavior. So so I, from UHV only I have got some clarity that how the association is considered for role of self and role of body. So this is a big thing for me to understand, and this should be propagate in healthcare system. I think that's from my side. And one more thing I want to add, that which we also tell about the relationship from with society and nature. So that relationship also matters a lot. That nowadays, as we are facing loneliness and we are facing depression, so this UHV, through UHV, I learned that how we are all related with each other. This is not a matter of labeling the relation like this is my dadi or this is my auntie uncle, but in fact we all are related with. So for a simple example I want to put here, at old age, I saw my parents too, and many uh, old age persons, that they used to sit in a lobby where they can see the road where people are walking, people are selling something, because they want they can associate the relationship with that people who are walking on road, but might be they are not recognizing that relation. And that's how we can say that in society we all are, how we are all related with each other, and we need this. So it's very beautiful that at the level of self only, we all are equal. And but just at the this is, and we all have the so much potential. So to be equal at the level of sanskar, of right understanding and right feeling. So it will make a difference. I hope we will come out from the yo-yo stage and detoxify the self. Thank you.
Thank you, Dr. Monica. I can see how well you're exploring the proposals on UHV and also the impact of self on the body and it has on the health of the body. And I can see why you're so staunch in your um, decision to take it forward as a program to your students. Thank you very much for that. So
Thank you.
now I would
Under your guidance of all, I'm exploring this.
Yeah, thank you. Thank you. So I would like to ask Dr. Satyanarayanan, sir, you are already implementing these
Yeah,
workshop
yes,
FTPs
yeah,
on UHV and holistic health in your
yes,
institutions. Now,
exactly.
I would like to ask the possibility of
Mm.
developing holistic wellness centers in your institution.
Yes. Yeah, actually, developing holistic wellness centers is a challenging thing, I feel. But still, it is not impossible because, the challenging, I say, because the availability of the resource, I mean, the expertise in that field, it is very less. So, what I am thinking is, what we think is, we start in 4 phases. So, first phase will be, we assess the need of the faculties or students or community. So, by a survey, we need to assess the needs. Then, followed by second phase, we can start with some small level clinics, the holistic wellness center, where we can counsel the patients as well as, we can educate the patients. And also at the same time, we can introduce the learning things also, like, that you can give them some for example, you can use to by conducting seminars, as well as, you can introduce the counseling sessions, like that. Then phase three, we can build up. If based on the feedback, if it is good, then we can go into the phase three level, where we can holistic center can be established. At the same time, we can plan the academic support from the students. The students can be regularly posted there, get trained, and also we can focus on the research on holistic health. So all this can be only available in a gradual manner. We can plan in such a way that, and finally, under one roof, we can plan, universal human values, as well as, holistic human health, as well as, the academic research on holistic human health, as well as universal human values research. So this, on the long run, till we are planning like that. But I think it is a challenging thing, but slowly we can think about those lines. Thank you.
Thank you, sir. I can see how structured you are in your vision. Your vision for the long term is very inspiring. Bring it all under one roof and to go with it in a phased manner so that it
Yeah.
doesn't face any hitches on the way. That's very nice to take it from you, sir.
Yeah.
Now I would like to ask Dr. Akhilesh, sir, the possibility of holistic wellness centers
Madam,
and
what I
the
feel is,
impact.
yeah,
Sir?
already we have so many centers. So just we need to convert that center as a holistic wellness center. There's no need of creating a separate kind of unit or separate kind of setup for that. The same center we have to convert, we have to train our people, and we have to just start providing the holistic human health to our um, students, patients, and all other people. We have infrastructure already available with us. Just we have to utilize it in the right way. And once we have such a course available, and we are undergoing the proper training of how to do and what are the things we have to deal with, then our people will be equipped, they will be skilled to provide such kind of facilities to their patients, to their students, and all. So that way we can, I think that will be the right utilization of the infrastructure we are already having.
Yeah, thank you, sir, for that crisp and very impactful answer. Thank you, sir. So now we'll move on to the challenges that anticipated challenges for those who are yet to start and for the challenges that were faced by those of us who have already implemented it. I would like to start with Dr. Swapan sir. So, what are some of the challenges you faced when you first started such a program in your institution?
First challenge was again means who will teach it, because as we all know that there are not special teachers and this is not a course which is being taught. The teachers are we never learned it, or we never were taught in our student days. So the teachers are coming from the different courses. So the teachers are already there, as Akhilesh sir also said that the infrastructure is already there. So we already have the teachers, but then they are not going through this human values course. So that is how I think we are fortunate enough in my institute. It comes under Punjab Technical University, Kapurthala. So it was one of the first university to introduce this UHV course in 2011. And then it conducted a lot of workshops. So that is what I'm saying, that it has to come from the top. If it's coming from the top, and it was a 3-credit hour course. It was not a course like just satisfactory or non-satisfactory. So vision was there that if it has to be given to the students, then it has to be the credit hour course. But then the biggest challenge was the teachers, trainers. So then means a lot of workshops were conducted in those days, and the teachers were sent, and the PTU, because it was our we are related to that. They always used to send the notices that send your teachers. So teachers all went there, and then they started going through these workshops, face-to-face, 8 days workshop during those days. And I think then they started getting prepared. But then I think there's a resistance from the teachers, because sometimes they're coming from different fields. They feel that they don't want to leave their field, and means what this course is human values, and in a way that's a block in our mind. So that is, I think, the biggest challenge, how to make them to come from the different fields and see the relevance of this course. And then obviously the people who are at the top, sometimes I will not say that means they are resisting, because in their fields, like their core fields of various, like maybe pharmacy, maybe B.Tech, so they are not even means that they're getting this issue of getting the teachers in their field also, good teachers. And so they don't want that their teachers should be going in this field and they're losing a teacher. Because like, if I give you my example, that the biggest challenge I faced, somebody told me that, okay, you take this course. One challenge was this, I was scared that how can I go to the class without preparation, because I knew the nature of this course is that people are looking at you. Like another course, like if you're teaching physics or mathematics, people are not judging you. But here, because this was about a value system, so students are looking at you also. So even it took a lot of time me to get into this. But then I got into it. Now I got the importance of, I know that how it has helped me. And now I think I'm trying to take it forward, but still the teacher's mindset is the biggest challenge. And then convincing their top directors. So that is what I'm saying, that more and more workshops will help. The FDPs will help. And then slowly and slowly, when the teachers will decide that it is helping them. And I want to tell you that students, at the students level, they're taking it very nicely, because their preconditionings are less. They're listening to it. But then the teacher is the key. So I think the biggest challenge for all of us is to means, first of all, convincing the teacher, not convincing them. Like now I have got a team with me, trying to get them, always there to help them. So the biggest challenge is how to train the teachers and how they will stand in the class and they will live with it. Means it's very important. They don't preach it. They live with it. Then only it will bring the results. Otherwise, I think it will just become another course and it will just reach as an information. So I think this is my take. Teacher is the key, how they get trained and how they take it to the class. Thank you.
Thank you, Dr. Swapan. I would like to ask the same questions to Dr. Vidya. She's very interested in this, and she sees also the possibility of taking up such workshops in her institution. By now, I'm sure she might have come up anticipated challenges that she would be facing in her institution, like some of the guidances she might be needing.
Yes. Can
Like
I?
to share that with us, Dr. Vidya? Yes, yes.
See, as I told you already, I'm very much interested in implementing this. So, what I'm seeing is I am having some plus and minus also. First, the hard things what I'm going to face, that is the challenges what I am going to feel, what I feel right now is first thing, this is my first experience in this course. Little knowledge is more dangerous and it is not enough to start also. So, first, I should be very thorough in this. As I told you already, I am ready to undergo some faculty programs and I have to have a thorough knowledge in this. And second thing, I myself have a doubt that still there will be a social stigma, even though we preach or we are going to practice this holistic health program. How the public will accept and how they will take, and whether really they will be undergoing all these things and really they'll be ready to do some sort of exercises, some sort of good things, and they have to behave well with the society, and they are having lots and lots of pressure. Society, as I told you expect yesterday, there are lot many expectations of the individuals by the society is putting a pressure, and we people are in a situation, we are running behind many struggles. In spite of that, the essence of this program is we have to spend time for this holistic health approach. So whether the people will be ready to spend their time valuably, that is the thing. So these are the things which are getting into your mind when I am talking about this sort of process. So all these things are still, it will be a big challenge for me to start this thing. But the merits, what I have is like, what I feel is always the manpower should be there. So rest of the things we can get by somehow or other. So I do have a good manpower in my institute. We are running two teacher educational college, and one nursing college is there, one pharmacy college is there, and we have ample number of students. Students are the best resource persons. So once we train them, and as I told, it's very difficult to find the teachers. That was the big challenge we faced. So once I was able to train my students, that is the future teachers, I think they'll take their role properly. So there is a lot of merits also with me. I feel is I do have some resources, so that if I am very much pretty enough confident like this will work it, and then I can implement it with a better confidence. So I have to overcome all my doubts and queries and all these things, that social stigma, everything. And if once when I become confident, I will implement with all the powers, all the facilities. What do I have? And you people are the best resource persons, and you are giving enough guidance to us. So under your guidance, in future it will be possible. First, before all that, I should get a perfect idea and perfect knowledge of this particular course. So that is my viewpoint right now.
Yeah. I can see, Dr. Vidya, your concern. Like when I started exploring this, I had the same doubts like you. But I promise that once we start realizing the truth within us, and we see that all human beings are the same, when that truth is realized, then the doubt automatically disappears. I think when you start exploring these contents, since you
Start
are
it.
very much interested, you will
Yes.
see the truth, and I'm pretty sure all these doubts will be vanished. And since you're already in a policy making position, that is going to be a easy cakewalk for you to introduce these courses and FTPs in your institution.
Yeah,
So
I
I
am also
welcome.
looking for. Yeah, yeah. I
Uh,
am also looking forward to be a part of you people only. But what I feel is I should know fully. Then only I should get into it. So that is
yes,
my only concern. Yeah,
yes, we
thank you.
have lots of FTPs online. if you cannot spare your move away from your place, online FTPs are there, and face-to-face FTPs are also being conducted in nearby institutions. Just you can get in contact with regional coordinators or even with me if you have interest in joining some of the workshops. We are here to guide you. So
Sure.
thank you. Yeah, yeah.
Looking forward.
Yes, sir.
Looking forward.
Yeah. I would like to ask Dr. Satyanarayanan, sir. You have already conducted these workshops. So, can
Yeah.
you elaborate in a stepwise manner the challenges faced and how exactly you were able to overcome it in starting the first workshop
Yeah.
on
Yes.
UH, being in a
Yeah.
MBBS medical stream?
Yes.
Because
Yes.
it's
Yes.
already there and going well in engineering side.
Yeah.
In
Yes. Yes.
medical
Yes.
side, I understand that all over India, especially in modern medicine, in allopathy side, only two institutions are there, and SRM is one. So we would really like to hear from you how you approach the
Yeah.
steps and you were able to overcome it.
Yeah, I think you were with me, in this all the whole process. So you also know well. But anyhow, I'll elaborate all this, the process. See, first thing, after we finished our UHE2, we were transformed, partially transformed, totally transformed. We like to give this gift to our students also. So what we thought was, initially, we like to sensitize the faculties. But as Mr. Swapan Chananaji has, problem with the faculties, the same problem arose here also. The number of faculties turning out. We planned in a systematic way, so 40 people, 20 faculties per session, spanning over a week, we have planned. But the turnout rate was very less, very less number of people came. But still, we overcame that, we persisted. With determination, we proceed further. And then we plan to implement to the students. Surprisingly, the administrators on our institute, they have never gave, they give full support. They never bear the barrier. So you can do whatever you want like that. So we plan to introduce this to MBBS students. So we put this into academic council, and it was approved as a dreamed university. So we started with first year MBBS students, and we taught them the 16-hour course on Universal Human Values 1. So in that course, the feedback was very excellent. They were very much students were, they are very fresh from the schools, and they are also, they are exploring things, throughout the days. It was a pleasant experience for us. So what we thought was, we'll let us plan this into further. We can take into that into second year also. So recently we presented in the academic council the part two, UHE2 for the second year students, same group of students. So another challenge which we had is, the NMC curriculum. This is very tight, they have to fit in those curriculums. So how to fit this? That was a challenge. So what I found was, the last this year coming this year, no pressure that come. So I thought, foundation course is a 80-hour course. They recommend 80-hour course. They recommend for the freshers. So in that foundation course, part of ATCOM module. ATCOM means, attitude, ethics, and communication. So that part of the module we introduced this value because we found out in the definition of the goal for a medical graduate, Indian medical graduate, the NMC has mentioned values and responsiveness and attitude, ethics, like that. So that values were mentioned but not exactly carried out. So we thought of introducing into this ATCOM part of the ATCOM module. After every day 2 hours in the afternoon, 7 days, and the Binali was there with me, and it was an excellent experience. So the students were very much curious, very much open, and they interacted us with very well. At the end of the day, they were actually they want next class when it come like that. They were thinking like that. So then part of the program we introduced buddy club system, that those who are the UHE one taught students, a small group of students we named as buddy club. We tagged them along with the first years. So they were very much volunteered to the, to make the students settle here in our campus. So what I'm telling is, through this, though we can face challenges a lot, but if you determine to do things, we can easily do things. So whether you think you can, or you can't, you are right. So I think I thought, I can, so I can do this. So that's determination has to be there. Then we can do this. And we are planning to introduce the holistic human health course as a part of the electives, as NMC has recommended elective course in the third year, at the end of third year. We are planning to introduce holistic human health also in that way, so that if this first year batch, when they go to second year, they learn year two. When they go to third year, they learn holistic human health. When they go to fourth year, we are going to introduce the legal the human rights as well as legal things. Like that, in a systematic way, we plan to approach things. So challenges will be there definitely, but the challenges are the opportunities to overcome them. That is, we want to know our real courage is. Thank you.
Thank you, sir. I would just like to add on one point. Sir is also a member of medical education unit, and through medical education unit, we are able to accomplish all these courses,
Yeah.
like
Yes.
getting fund for the academic year to start up these workshops and all. And we are able to present it through the academic society of our institution and get approval for these courses. We have
Yeah.
already
And it comes with, yeah.
1 and 2.
Yeah.
Yeah, for MBBS students, and we have taken it as value-added courses, which is also
Yes.
recommended by the National Medical Council to introduce value-added courses.
Yeah, exactly.
So,
Yes. Correct.
thank you, Dr. Satya, sir. So, Dr. Monica, I would like to hear if you have anything more to add, because since you're also conducting these workshops in your institution, you're also taking classes. Were there any additional challenges that you faced, and any suggestions you would give us to all the delegates and viewers who are here with us?
What I want to add more is that we have to change our vocabulary first. Since long we are saying we are in very much confusion with I and my. I want to say we are using this word my body. We never use I body, but we never realize that this is there is so much gap in this. We use this my word for possession things. The I has a ability to possess body. So first of all, this confusion is should be omitted. One more, I want to rectify this statement. We at the early stage we are teaching children I am going to bath, I am going to sleep. So in books also we can change this line. We should maybe we can change this line as I instruct my body to bath. So it will be easy for our children to learn in a rightful way. First of all, it's my point of view. I don't know how much it is correct. But this is a bit because since long we are just listening this I am going to take bath. So it's just stuck in our mind that we are I, body is I. We are confusing with this. And how to implement it? Yes, what challenges are coming? So mainly we are in body consciousness. We are in too much in body consciousness. And many teenagers are in identity crisis. Like what I feel, they are putting more efforts on their appearance and their gadgets. And when we talk about students, when we talk about the gadgets with students, they are very say that we want iPhone, and they think that this is if they don't have such things, then how can they enjoy the life? So yes, to make clarity for this identity, to come out self sorry, to make them clear concept. It's a big challenge for right now for teenagers.
Yes. Thank you, Dr. Monica. From what I can gather from you say is that the one of the challenges to bring forth these courses is to move away from body consciousness and come to the realization that we are coexistence of self and the body. So one of the way you suggest is we start with the way we speak, change the vocabulary and the meaning we give to words. So I think that is what you are trying to say all along, and your point is well taken. So when we start saying we tend to think that that I means the body. So when, right, like you rightly pointed out, I instruct my body to do. So there's this clear differentiation. I and the body, and we naturally tend to ask the question, so who is that I when I instruct the body? And there comes the concept of self. So you were trying to tell that when this becomes our routine vocabulary in home, in schools, and in colleges, then it'll be easier to bring about this concept of self and to the curiosity to learn more about this. And then it'll be easier to introduce these courses.
Yes, yes, yes.
Yes, thank
I
you.
want to
Thank you,
put this.
Dr. Pranita. Yes, thank you. So, Dr. Akhilesh, sir, I would like to lastly ask, so this is my personal doubt because I have been trained all along in allopathy and I have only very little idea about Ayurvedic sciences, and you're working in All India Institute of Ayurveda. So, is this holistic center there in your curriculum, or is it in your institutions you have individually started these holistic centers?
Yeah, and as I told that it is not like we have started holistic center. The concept like the human being is an union of body and self that is there in Ayurveda from the very beginning itself. And like the physical, mental, social, spiritual, so these all aspects are already there in our um, curriculum. And when we deal about the modalities of treatment, we have the modalities of treatment we say as the spiritual treatment, psycho-spiritual therapies. That is also one kind of modalities which are included in, along with the medicines. We say that the yukti vyapashra chikitsa. Yukti means different kinds of plannings, planning of the medicine, planning of the diet and all. But we have the another set of treatment which we say that the psycho-spiritual therapies that is also included in the Ayurveda. But if you say that whether we are having a proper training and we are really doing it practically, then I will say still we need to improve in this aspect. And lot of proper way of dealing of it need to be given to our budding doctors, and then only it will be possible. Because most of the time, what is happening in here also is we are more concerned about bringing back all the biological parameters to the limit. But sometimes, like recently, we conducted a survey about the spiritual need of the patients, whether the patient feel that their spiritual health is properly taken care by the doctor or not, whether he is able to share all his spiritual need to the doctors or not. So we found that many of the patients they are saying is they are not very much comfortable in sharing all those kind of aspects, like their religious belief, their other things, they are visiting temples or they are following some kind of thing. So that many a times they do not say to the doctors, but they are doing it when they are ill. And whether these things are giving them the positive effect, so they say yes, these are the things they help them to get rid of the disease or to overcome the problems. So I too feel that there is a need of such programs, such proper training courses, even including in the Ayurveda educational centers. And I also agree with my previous speaker, Dr. Satnarayan ji, Dr. Vidya Madam, that there is a lot of challenges. And challenges will come from every aspect, every corner. Challenges will come from the authorities, from the participants. But the thing is, we cannot expect the change in overnight. Once I have the course and the people will be very much ready and they will come and they will undergo the course and there will be whole change. This cannot happen. But the thing is, when we have realized that there is a need of change in the present structure or the present curricula or whatever the kind of things we have, and we have realized that there is a need of change, then someone has to take the lead of this. And as we have a very wonderful group supporting each other, so somewhere we have to start. And slowly, I think the things will get changed. Once there will be positive outcome, then gradually the acceptance will increase. The same thing I have heard from the Ganesh ji about the UHV course, that they have to face a lot of trouble to bring it in the curricula, but now it is like it is the really universally accepted course. The same thing I am very much sure it will come for the holistic health also. There will be a lot of challenges, but once we are coming out with some kind of positive results, then the people will be very much welcoming for all those courses. So that is what I am feeling that we cannot let the things go in its own way, and things when going wrong, we cannot just keep mum and seeing everything that it will happen. Somewhere we have to do our part. And as being a medical professionals, it is our duty that we should not let go the society fall ill. So somewhere we have to take the initiation and we have to stop this process. So gradually I feel that the positive change will come. Thanks, madam.
Thank you, Dr. Akhilesh. So, Dr. Satyanarayanan, so we seem to be in like a step forward in taking up these courses
Yeah.
and setting up holistic wellness centers. So, on
Yeah.
behalf of the delegates and YouTube viewers and the other panelists who are present here, I would like to ask, could they all expect some guidance from our institution, from your institution, when they are ready to set up such programs?
Yeah, it's a good question. But now, if we are ready, our institution is ready. I assure that. So if we plan, definitely it will be implemented. So we can plan it, in a quicker way, we can plan it, and soon we'll start the working on it. Definitely we'll implement that. And of course, Dr. Akhilesh Shuklaji is there, and Dr. Shamla Asthanaji is there. So the experts are there in the field to support us. So with their support, I think we can start doing things. Thank you.
Thank you, sir. So it's
Yeah.
almost time to end the panel discussion, 10 more minutes.
Yeah.
And I would like to get some specific commitments. Since I can see all of us present here are already committed at individual level to undergo these courses and to start the exploration process, I would like to get some specific commitments in terms of the institutional level in which you are associated with. How would you commit yourself to taking forward these courses and setting up holistic centers? I would like to start with Dr. Vidya, since she seems to be a very eligible
Mhm.
panelist here.
Yeah, yes, as I told already, I'm ready to start these kind of things. The first commitment what I can give is first I have to engage myself in this course. So I have to get better knowledge regarding everything. And then I would like to start this first in my among my nursing students. So I would like to start some small workshops or 1 day or 2 day face-to-face program under your guidance. So if you provide, if you are able to provide some resource persons at your convenient time, we can also make my students, so I can plan all the arrangements. So it won't be a problem at all. So we will be ready to go about. So this will be my first commitment, and then in future it has to be developed, and I can promise it will be developed once it works.
Thank you, Dr. Vidya. Thank you. And there are definitely resource persons. You can get in contact with any of us. You can get in contact with me. Yes. And we'll meet in the next FTP in your institution. Thank you. Yeah, and I would like to also get commitments from Dr. Swapan and Dr. Monica about some specific commitments that you would like to do in your institution in addition to what is already going on. Maybe your future vision, how to take it a little more along the path. Dr. Swapan?
So yes, already I've taken the UHV and the team is there already, and we are talking about the health in that, but now this new vision about these 3 days, we have got that holistic human health. And I think the people are more concerned about the body and they want healthy awareness, health, they want to be healthy. Awareness is already there. But then this holistic health, I think we have to take it further. Means the concept of self and then environment. So I think again, my commitment is this, that I will again talk to the, first of all, the directors and the top people to, and then we'll hold some workshops where the experts can be there, and we can start with that. Okay, some workshops, some like seminar telling about the body, and but then to some catchy line can be there, and then we can have expert where they will talk about this holistic. So I'm very much committed. Already the UHV, it has given benefit to me and to my institution, my surroundings. But now the next step is holistic health education. So I'm very much committed, and we will do whole workshops first of all, and then slowly we'll add value-added courses, and then full courses can also be there with all structure and with all the mentors guidance. We'll take it further. Thank you.
Papan. Now over to Dr. Monica.
Yeah, I am very much determined to do this job. Already we have UHV in our institute. So for about the holistic center, I will give this proposal to my HOD, and we will do more workshop on this, and we will large our UHV team, which is of 2 and 3 teachers right now among 15,000 students, I think. So we will expand this UHV team, and I'm very much determined to do this under all resource person and under your guidance. Thank you.
Now, Dr. Satya sir, you're doing so
Yeah.
much. And do you think there's any additional commitments that you could commit to?
Yeah, I think at this juncture, I like to tell that, we can include this UHE 1 and 2 for AHS students, Allied Health Sciences students also in our, college, where they're a larger part of the community, they are there. So we can also introduce this to physiotherapy students, nursing students, pharmacy, dental students, so that, we can, values and can be spread to everyone. So that is what the extra commitment. But still, I can see it's bright and, very bright. Future is bright for UHV in our institution, because we have a dedicated value education cell. With their support, we can do a lot. Let us do it. Thank you.
Thank you, sir. And lastly, to Dr. Agnesh Shukla, would you like to add your commitments?
Yeah, ma'am, definitely.
Oh, you're
So actually,
already doing so much. You're a huge part and a huge strength of this UHV community. I know it, but still, is there anything
I
else you
will,
can? Yeah.
yeah, I already told that the UHV has created a very favorable platform for us for entering of the holistic human health course. So I think wherever the UHV is running, there we can have a very uh, easy entry in those institutions. The other thing what I feel is for the holistic human health, there will be more challenges, because at different stage where our health needs are different. For kids, there is a different need. For female, there is a different need. For adult, different need. And for pregnant women, different need. Lactating women, different need. Old age. So, like for when we are going for the holistic health and we are talking about it, there will be a lot of challenges. And when I see that the people from the very reputed institutes are joining with us, I see a very positive uh, beginning, and the future, a very positive future of this course also. Because all together, one or two people cannot bring a very big change. So all together, we can do a lot of things. And once it will start in these institutions, then actually we can also refine our course in a much better way, because these courses require a gradual changes, and whatever the other aspects are there, that all we have to enrich our course to make it more and more suitable. So with these favorable institution, I think these all you all can help in our this, and all together we can do a lot of things. Thank you, madam.
Yes. Thank you, sir. I happened to go through the holistic health book, and regarding the different needs you said to different individual, I'd like to add that there are certain principles, universal principles that are universal, rational, and feasible to all. And the recommendations, the need part, what you were telling about, it's different for different. So that comes under recommendations. So when we follow the recommendations based on principles, I think that would come under the universal concept. So I think that should be a way to go forward. It's already there. Yeah. Thank you. Thank you, sir. Thank you, sir. And that was a very nice panel discussion, very interesting. And we have 3 minutes left, and there's one question from a delegate. The question is whether due to lobby of pharmacy globally, the range of super levels have been reduced to make patients depend on medicine. I'm not exactly able to understand the meaning of what super level, but if any of the panelists here is able to understand and would like to answer to it, whether due to lobby of pharmacy globally, the range of, I think the context, the essence of this question is that is it due to pharmacy lobby, pharmacy industry that patients are made to depend only on medicine and not to resort to this holistic approach? I think anyone of you can try to answer the question. Dr.
Yeah.
Satyanarayan.
Yeah, I think I can. So I think is thinking that that the levels of the blood pressure levels, they brought down normal levels beyond which treatment is, not required like that. But I feel, instead of focusing upon medicine and treatment, we can focus upon the preventive aspects. That will solve, you should have two approaches. One is either problem centric or solution centric. So problems are many, industry or whatever it is, the lobby, whatever it is. But we should aim for a solution. The solution is we can promote a program for health, the healthy life, for staying healthy, intake and routine, and labor and exercise, and breathing and posture regulation. So like that. So that's what I feel. We should focus upon the solution. So solution is solution is bringing the self consciousness in. Then instead of feeling isolated, we can feel the part of the whole, part of the family, part of the society, part of the nature. If we feel like that, so the drugs may not require at all. So the root cause of the disease can be found, so we can prevent the diseases. That's what I feel. Thank you.
I hope this answered the question asked by Mr. Chandrasekhar Bogle. I am not sure if he's listening to it, but yeah, we have come to the end of our panel discussion, a 3-day long panel discussion on need, vision, and implementation. And I'm very glad we were able to make this happen. And thank you so much, panelists, for all your participation, for the time spent here. And I know Dr. Vidya, Dr. Swapan, and Dr. Monica, you're with us for all the 3 days. Thank you so much for your commitment to be present here and to share your insights. So this is going to make a huge impact on people who are listening and to the society. Just to throw in a small seed of curiosity for the need and the way forward with vision and implementation. I thank you all wholeheartedly once again. Thank you so much.
Thank you all.
Thank you. Namaste.
Thank you all.
Thank you.
Thank you all and namaste.
So thank you all our panelists once again.
Thank you.
And it was
Thank you, Deepesh.
really,
Thank you.
I mean, audible.
Yes, you're audible.
Yes,
Yeah.
yes, sir. Yes, sir.
Just to close it officially, the
Yeah.
panel discussion. So it was nice to have you all for the 3 days, last 3 days, getting each other, sharing experiences about the holistic health part. So the panel discussions probably might be stopping right now here, but the exploration actually continues. What I able to see. So let's co-work together, as many of our participants said, and we were able to agree or see that the purpose is there, and the vision is there, and we will try to make out our contribution for implementing this holistic health part for the betterment of the society, community, and the people and the students at large. So thank you all, our esteemed panelists, for a very fruitful sessions, and Dr. Mrinalini, who was the moderator of the session. And thank you all the delegates who have joined, and also participants who have joined via YouTube and live streaming. And so we will be having the plenary at 1:30 a.m. I would request you all to be part of that, so that we have the conclusion of what we had in the last 3 days of discussion. Right. So once again, thank you all. Namaste.
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 Thank you so much, sir.
Bye. Good night.
Namaste to all.
Namaste.